I'm Mark, and I came to Dr. Krakovsky 3 years ago to have a penile lengthening surgery. I think the subject of penile lengthening is something that most men are very ashamed to admit, that they would like a larger penis. I researched the subject very thoroughly on the internet. I found that there was quite a few negative aspects to the procedure, but vastly the reason that the negative side effects, I believe, were because of an antiquated procedure and also an inexperienced surgeon. However, what I found was unanimous, that the vast majority of them that had bad side effects were because of the procedure that they provided, along with an inexperienced technique. Dr. Krakovsky was the only one that had the kind of experience educationally, articles in medical journals that he'd written, and he taught his procedure internationally, which spoke a lot to me, simply because if he's the guy that's teaching other people how to do this procedure, he's the guy that you'd want to go to. So after about 3 months of study online, I decided to have the lengthening procedure. I spoke with Dr. Krakovsky 3 times on the phone over a course of about a month. He never became annoyed with any of my questions, and I was purposely redundant in asking these questions just to make sure that he was giving me the straight scoop. My main concerns were primarily erection angle, because that was one of the subjects online that a vast majority of the patients that had procedures were complaining about. They had lost some erection quality, the unstable erection. I was really concerned about that. I was concerned about the scar visibility, and additionally, I wanted to know for certain, how much length I was actually going to achieve with the procedure. Dr. Krakovsky said, they could not determine exactly how much length it could be, between 1 inch to 2 inches or more, up to 3, depending on the thickness of the ligament. He went into a great deal talking about the genetical makeup of ligament tissue within the vast majority of men, most of them having up to 90% very thick ligaments, and the guys that had the thinner ligament type were the guys that had the probability of gaining the most stretch or the most length. However, there was probably less than 10% of the patients that he'd seen that had that thin type ligament tissue. And there's no way to determine through scans or any other medical investigation other than once you make the incision and you see the exact size of the ligament. So based on that, I knew exactly what I was getting into. I had no idea what ligament size mine was, but I felt a 1 inch gain would be a substantial gain, and I was really happy to hear that. The day before the surgery, he examined me and thoroughly went over the procedure again, and then the following morning he picked me up at the hotel. We went to the surgery center. We met the staff, the anesthesiologist, the head nurse, the receptionist. Everybody was very professional and very welcoming. I felt right at home. They discussed the procedure again and prepped me for the procedure. We took some before pictures. The surgery went well. Upon awakening, Dr. K greeted me and asked me how I felt. He greeted me with good news. He said you had approximately 1 inch minimum up to 1.5 inches of gain through the surgery. He told me the following day to come back to the office. Immediately upon awakening, I had my customary nocturnal erection, and also a little bit of pain, a little bit of swelling, but my erection was visibly larger from the very beginning. He had instructed me to start the moderate hand stretching, not anything severe or to the point of pain, but just to start stretching. Went back to his office the following morning, met with him. He inspected the incision site. Everything looked good. He said, take it easy for the rest of the day, you know, take a couple naps, get up and walk around a little bit. Came back the following afternoon around 4 o'clock, inspected this incision site again. A little bit of swelling, but nothing unordinary. A little bit of pain, a tenderness, but nothing that was disabling or anything along those lines. So the following morning I got back up and took the pain meds as prescribed and flew back home. Began using the traction device that he recommended using, and that was on a, I think that was probably one of the most important things to ensure that the length that I had gotten from the surgery was going to be there and be permanent. So I was very dedicated with that and followed his recommendations to the letter. Within a few days, I was back to work. Within a week, I was going back to the gym, working out. Within 3 weeks, I was golfing again. And the good part was I was resuming sexual activity within a couple weeks, a little over a couple weeks, and no problems at all. Really, this whole procedure is somewhat considered to be like a marathon because it does take some time. It's not a sprint, and I wouldn't want to mislead anybody into thinking that, oh, you just have the surgery and automatically you gain this length and you're good to go. No, this requires a little bit of dedication afterwards. Like most men, I think they're concerned with their flaccid size after their procedure. I used to shrink up quite a bit. I call it turtle. And when you're walking about in the men's locker room, if you happen to be a person that visits the gym and likes to exercise, the last thing is it's really embarrassing to walk around with this shrunken thimble-sized penis that you could barely see. I don't have that fear any longer. I'm happy to say that even on a cold day, I'm usually right around 5 inches in the flaccid state. On good days when it's warm, I'm closer to 6 inches. And you know, I read online guys concerned about the erection quality. The surgery, I actually believe, has enhanced my erection quality. I have not lost any erection quality as far as the angle, and no instability side to side or anything like that. It's just right. And then also, I'm having the best sex of my life, and I'm 56 years old. To wrap it up, I would say if you're seriously interested in the lengthening procedure, that you call and talk to Dr. Krakovsky. I couldn't be happier with the results we have achieved. It was a team effort. If you read stuff online that's negative, you gotta set it aside. It's probably a physician that doesn't have the skills, doesn't have the technique, and I would say talk to Dr. K.